Thank you very much, Alan. Thank you, Jasper and Luca. You have indeed, the earlier panelists have provided a broader perspective. I work with the National Drought Management Authority, which was established by the Kenya government through an act of parliament to address drought, food security in arid and semi-arid areas of Kenya, which is actually 80% of the Kenyan landmass, and whereas over 60% of all livestock are found. I will be narrower than earlier panelists because I will give the Kenyan perspective. Next slide. Yeah, the arid and semi-arid lands communities of Kenya face climatic shocks that lead to periodic losses and damages. For example, 2008 11 drought. The country, the cost of the drought to the economy was over 120 million US dollar, actually 900 million US dollars. And many of the pastoralists were forced out of their production system and became destitute in town. The production systems in these ASAL areas are basically pastoralism and climate and weather sensitive. The nutrition status of ASAL communities is directly related to livestock production performance. And as you know, livestock production is dependent on climate, on weather. Now, here, we are giving an example of Turkana County. The impact of droughts on nutrition of the children. And we can see the malnutrition rates. The blue bar at the top are the drought years. At the peak, we can see in February, and these are summaries, long-term averages. The highest that we ever had was 32% of children being malnourished, and this was a peak of a dry season. And we can also see the second bar, the graph, which was the least, the lowest figure that the Turkana County has ever experienced was 11% of children being malnourished. What this tells us is that at any one time, over 11% and on average 15% of children in good period are malnourished. And on average, during the drought periods, over 20, 22, 25% of the children are malnourished. The climate change has increased the intensity and the frequency of droughts in Kenya. And if no systems are put in place to address long-term systemic issues, then perhaps, and with the population growth, you might perhaps find these numbers going on. But of course, in Kenya, we have recently, we had devolved units, and with devolutions, there are quite of investments on resilience building measures. And perhaps with policy guideline, investment direction, we may reduce this gap and bring the children, malnourished children, perhaps below, at least below 15%. Yeah, so basically shows the relationship, of droughts, multi-year droughts with child malnutrition. And the data we collect is actually, and we have a historical data going up to the year 2000. Now, I will look into, and this has well been articulated by the earlier panelists, the institutions of family, government, informal institutions, and in my case, I will actually focus on culture and norms, UN agencies, which actually complement governments in their efforts, the markets, and the economy. Now, in terms of the family is the basic decision-making unit. It's also the basic unit of production. Within the family, the norms define who performs what function, what role, and therefore, even in terms of burden on children, in terms of gender, is an issue that really influence nutrition and malnutrition. If we focus on the family, understand the norms, then we can get right in terms of nutrition. Because perhaps, and I think in one of the panelists I've seen that the assumptions that we make, but it is also important that at the family level, the nutrition education, although of course eventually the decision on how to spend on where is dependent on the family income. But it's important that at that level, families also understand those issues, and then they get facilitated. Government institutions actually play a key role because they provide the policy environment, the legal environment within which the family, the individuals, other actors, civil society organization can perform their functions in order to deliver on nutrition mandate. In the Kenyan context, in the past, the nutrition food security was actually mainly dependent on our partners' advice and also investments. We relied mainly in the past on World Food Program, FAO in terms of information, and other UN agencies. However, in 2008, after 2008-11 drought, the IGAD region, actually the heads of state from the IGAD region, decided that they will end drought emergencies. And one of the issues that they have identified was that they should put in place institutions that will be held responsible for implementing government policy, provide information, guide governments and other actors on response and resilience measures. And Kenya government then established in 2011, actually National Drought Management Authority, which now bears the responsibility in terms of providing information at the right time, coordinating actors, and will be held responsible by government entities, by the media, and even by the communities if there are gaps in response, particularly in response measures. But of course, and we are also by law required to report annually to Parliament. I have earlier mentioned on informal institutions, the issues of culture and norms are very important because culture determines even what crops to produce, what foods to consume, who to consume what food, even within the household, who consumes, like if it is meat from a slaughtered animal, which part of the animal. and understanding of such norms is important. And where possible, where we perhaps need to influence, we influence. Where we need to leverage on, we leverage on. The UN agencies, and I am highlighting this, the UN agencies, civil society organizations, community-based organizations, faith-based organizations, these institutions actually complement the government in their service provision, including providing necessary information, linkages, regional linkages. For example, we have the IGAD region, we have the East African community, and particularly when it comes to drought, it usually affects, for example, the entire Horn of Africa. And pastoralists move across. And that movement is also sometimes associated with conflicts. The UN agencies, the IGAD, the East African community provides a framework where to allow us apply ecosystem-based approach in addressing drought-related movements and possible potential conflicts associated with such movements. My last one is on this one, on institutions, is markets and economy. It has been assumed, I've read in quite a number of literature, that the ASAL, the northern people, the ASAL communities, the pastoral communities are far removed from the economies. They're not well linked to the economies, to the markets, and that they're not much, they do not much benefit from the market economy, or they're also insulated. But in many years that we operated in these areas, that has changed. That has significantly changed. These communities are linked to the markets.
Now, I'm sorry, we seem to have lost Orre's presentation.
Thank you, Helen, and thank you very much. I apologize. There was a network problem. I will second last slide and then last slide. I was left with 2 slides, if that will be okay. Yeah. Coordination and the resource mobilization mechanism at national and subnational levels are some of the key institutional coordination mechanisms that we must have to address short-term and long-term challenges associated with child malnutrition. In the Kenyan case, we have the Kenya Food Security Meeting at the national level. We have Kenya County Steering Group and Intergovernmental Committee on Food, on Drought and Food Security. These institutions, this mechanism helps us in making decisions at the appropriate time and also making actually the appropriate decisions. We must also have, and here we're addressing the issues of systems, web-based drought response mechanism. Drought response requires that you respond appropriately and on time in order to save lives and livelihoods. We have, with the support of the European Union, managed to establish a web-based system where decisions are made actually within a day and the response triggered, requests made within a day, responded to within a day. And through the same mechanism, county governments, with the edified information that we provide, act within, being the first line of actors within appropriate time. And there are currently studies going on. Actually, there's a study now going on to compare our response mechanism for 2008 and 11 and the most recent drought. We must also have local, county, and national level drought contingency plans, helping communities, the local level institutions to develop drought contingency plans, building drought scenarios, and establishing their strengths, their capabilities, and what needs to be sourced externally, established well in advance is a major component of planning for drought impacts. And I really appreciate the role of the health sector, particularly the nutrition sector, in that at the county level, at the very local level, they are very active. We have district integrated first classification, integrated information system, which helps us identify the hotspots and develop response mechanisms. We need also to have a robust drought early warning and information system. Without reliable information, without credible information, you might not respond at an appropriate time, or even if you respond, it might not be the appropriate response. We must also, as a country, we have a funding mechanism for drought, and not only drought, we are actually now establishing a mechanism for all the disasters, such that we have set aside resources that address long-term resilience, preparedness, and immediate response. And we have also apportioned those resources in such a way that you build systems in the long run, but we have set aside resources just for response. The strategies should be linked to national and county plans and budgets. We have programs and projects. We have cash transfer programs, scalable cash transfer programs, where at the moment, 4 of our most drought vulnerable, poorest counties have 100,000 poorest households on regular cash transfers. And during drought period, when the purchasing power of the households are affected, that then is scaled up and down, because we have systems for response. We have opened bank accounts for these households. We have registered them. We have ranked them. So we have the Hunger Safety Net program, a cash transfer program. We have index-based livestock insurance, index-based crop insurance to help us on this. In terms of further information on some of the mechanisms that we have, you can visit our website, which is displayed. In terms of the information, I'm sure there are some of the panelists that are interested to know what are the nutrition status in our country. We produce monthly bulletins. We also we do IPC first classification biannually after we have bimodal rainfall, and all those reports and the other works that we do are found in our website, www.ndma.go.ke. Next. What are some of the sustainable solutions from our own experience? It's similar to actually what I've earlier presented. I'm not going to present much, but you must strengthen relevant institutions with a role on nutrition and food security outcomes at all levels, including local level. Provide mechanisms for accountability and reporting and information sharing. And this is very important. Without good accountability frameworks, you cannot lead, you cannot coordinate. Establish and institutionalize champions that will take responsibility for the delivery of the vision of the government. And in this case, for the Kenyan case, we have NDMA. When there's a challenge, then of course there's a problem. The government, the civil society organization, the communities have institutions to question. Establish and strengthen systems for data and information management. Data is key. With good data, good information, you can know where you are going, and what you need to do. Coordination and also resource mobilization internally and also externally. Thank you very much.